Good evening, everyone. It's 7:40 p.m. at the capital city of Ulaanbaatar, and we are ready for Today interview. I have very important guests tonight in our show. Head of the National Cardiovascular Center, Dr. Tolga Mogenchimuk, and President of European Society of Cardiologists, Professor Jeroen Baks. Thank you for receiving our invitation. So let's start talking about the National Conference of Cardiology.
Okay, thank you very much for your invitation. National Cardiovascular Conference has been organized already 15 years in Mongolia.
15 years?
Annually, yes. It's already become a benchmark of our cardiovascular team, who's working in every corner of Mongolia, all 21 provinces in 9 all 21 province hospital in 9 districts, and as well as the biggest hospital in Ulaanbaatar. And this is really an educational event for Mongolian cardiovascular field. It's where we gather once a year to share our knowledge, practice, experience, expertise each other, and also update our knowledge by latest the clinical information. Yeah, and it's also a good networking place.
Tell us about the European Society of Cardiologists.
Well, the European Society of Cardiologists is actually a large society. It started about 70 years ago, 70, so quite a long history, when the cardiologists felt that they needed to become united and stand for some European principles.
Right.
So it was founded about 70 years ago, and it actually represents the cardiology of Europe. So many people work together in this society. We have a headquarters, which is founded in Nice in the south of France. And then we have a second headquarters now, which is in Belgium, in Brussels, next to the European Parliament. And one of the things that we do there is influencing the decisions taken for the profession. So this is really focusing on advocacy. Now, what does the ESC do? It really represents the things that are important for cardiologists. Right. It started, as I pointed out, in Europe, but I would say maybe after 10 years of existence, it became clear that many cardiologists outside of Europe were also
involved. Wow.
So we have started with a biannual congress, and then it shifted towards an annual congress. And that annual congress is held in one of the major cities in Europe every year. So we just had one. It was at the last week of August. It was held in Barcelona, the capital city of Spain. And actually, we hosted there about 33,000 cardiologists from all over the world.
43,000?
Yeah,
That's a big number.
33,000, yeah.
Wow, 43,000.
From all over the world. And that covers from Australia to Asia, to South America, to North America, to Canada, to all over Europe, to Africa, basically all partners worldwide.
So how about when the activities are concerned? What are the activities?
We have this main congress, which we work for the full year. The full year, we start now preparing for Munich in 2018 in Germany, also at the end of August, beginning of September, but we have lots of other activities as well. The big ones are, of course, focused on education, because we like to make a good contribution to the education of the cardiologists. So what does that include? All the material that is presented at the Congress is videotaped, and that can all be reviewed afterwards for 365 days long. We call it ESC 365, and that means that you can re-see all the presentations from wherever you are in the world, and the access is for free. So partners for free. All partners can profit from that. And then we also develop our major guidelines. The guidelines are focused on very big clinical topics in cardiology, such as the treatment of myocardial infarction, the treatment of heart failure, the treatment of arrhythmias. What do we do in the case of sudden death? How do we treat the patients with heart valve disease? So every year we release about 4 to 5 guidelines focusing on very big topics in clinical cardiology. And the preparation of one such a guideline lasts 2 years. And after 5 or 6 years, usually we update them because then there's lots of new evidence.
Right.
What sort of evidence do we use? We use the evidence from randomized controlled trials. So in these trials, a specific new medication is evaluated.
So my next question is for both of you. What has cardiology achieved in general?
Well, I think cardiology has achieved a lot, really a lot. So if we think about in the past, when a patient got a myocardial infarction, in normal words, a heart attack.
Oh, okay,
The
heart
patient-
attack.
a heart attack.
That would.
A heart attack.
Okay.
So the patient was put at rest for several weeks, and that was it. Nowadays, we know that we can actually go with catheters to the heart. We put a catheter in the groin, we go through an artery that goes then
right.
to the heart, and then we see with contrast where the obstruction in the coronary arteries is, which causes the heart attack. And then we can go in and we can actually open that vessel again with a balloon. So we inflate the balloon inside the vessel, and then we position what we call a stent, which keeps the vessel open. And that way you limited very much the infarct size. So in the past you create a big scar in the heart, which resulted in poor heart function, eventually heart failure.
Eventually, in later
In the
days,
past,
right?
yeah,
Later.
over time. And nowadays we can prevent that by these acute interventions. You can do that with some medication that you give in the vessels, so that dissolves actually the occlusion. But we can also do it mechanically with the balloon and then positioning what we call the stent. So that's a major breakthrough that saved a lot of lives and that prevents a lot of heart failure. Secondary is that we have developed over the years bypass surgery. Another thing which is very big is heart transplantation. So many years ago it was possible, but these are major breakthroughs. And we can also, one last one that is very important is the heart valves. Over the years, with the aging population, we start to see that the valves are getting older. And when they're getting older, they're starting to function less. So they start to leak or they start to become obstructive. And when that happens, you get symptoms and eventually you can die. And we can also prevent that now. We can have ways of surgical repair that or replace, put an artificial valve in the sick valve.
Artificial valve?
Artificial valve.
Is it made by 3D printing?
No, it can be nowadays, but in the past we had two. We had a totally artificial valve, or we could take it from animals like a porcine valve.
Wow. I was just wondering when you mentioned about heart transplantation, what is the longest recorded lifetime after the surgery?
I don't know exactly that, but we have cases where it's more than 10 years, more than 15 years, so it's significant. People who would have otherwise died can live with a new heart.
Yeah. Wow.
No, it is fantastic.
These
The first one was done by
results.
a guy called Barnard in South Africa, and this was 50 years ago nowadays. Exactly this year, we're celebrating the 50th anniversary of heart transplantation.
Wow.
Barnard in South Africa.
South Africa.
Yeah.
Nice.
Did the first heart transplant.
And let's talk about Mongolia. What's the cardiology in Mongolia? What's the situation? What are the problems or what are the mortality rate? Has it been decreasing?
Yeah. Well, in Mongolia, mortality rate was very high last more than 20 years. But with the accentuating and the treatment, early diagnosis and the better diagnosis and better treatment, management, all together, that means we are, all cardiology of Mongolia is connected through the telemedicine to online system, which is making us as one team connected to each other.
So there's an online platform to connect all the cardiologists now in Mongolia?
Yes, we have an online platform for all our cardiology patients. So this is one of the biggest strengths of Mongolian cardiovascular field.
So the next question is, how are you guys preparing the next generation cardiologists in Europe, in the world, and as well as in Mongolia?
Well, things change. Things change. In Europe, we see, for example, that new things are coming. You just spoke about a couple of things. In Europe, what is coming is a lot of digital health. So
Digital
there is internet connections, there is a lot of e-health and m-health, they call it. Sooner or later, you're not going to come to the outpatient clinic as a patient anymore, but it will go through a video conference where you are at home. And this is, of course, for control situations, not for acute situations.
Right.
But that will diminish traveling times, etc., and make it more easier. We also have, for example, we spoke about innovations. Pacemakers have been a big innovation.
Right.
When your heart rhythm was not working anymore, we can now implant a pacemaker. It's a small motor, so to say, who actually keeps your heart going. Now, these pacemakers, they need regular checkups. In the past, the patient had to come to the outpatient clinic. Now what happens? They put it to the phone with a connection, and the data are immediately transmitted to the hospital.
Wow,
and we
it's
can
like a
read it out
movie.
there. Yeah, this is
It's a
happening.
sci-fi movie.
So actually, the younger generation have to be prepared for a lot of these things. And as we just discussed, cardiology is constantly changing. So things need to be adapted. And the younger generation is going to be confronted with that. So the way of education is changing.
It's changing.
And we still have textbook, but we also have online information. And this online information, they surf through it. So they have a question, they surf through the answer, and from the answer they go to another question and then to another answer. Whereas what we did was we were reading a book from A to Z. So the ways of education are changing. So there's a lot of things that will be different in the future. E-health, m-health, education, etc.
Right.
But also practicing medicine. And I think that is what we try to guide through our European Society of Cardiology.
And how about the heart disease reasons in Mongolia? What is the biggest problem the Mongolian patients are facing? And the reason of the heart disease, has it been changed over the years throughout the world as well as in Mongolia?
First one is smoking.
Smoking.
Yeah.
And how does smoking affect your heart? Like physically, what happens? Because I know smoking is bad for health, but I don't know what happens in my body when I smoke.
Well, you know, one of the things that we see in most individuals is with the sedentary lifestyle, with the not so good diets, lack of exercise, high blood pressure, all of that directly or indirectly contributes to we call that atherosclerosis, which is accumulation of cholesterol in the vessel wall. And if there is
Vessel wall.
in the heart vessel, you know, the arteries, the small vessels that bring the blood to the heart, from which it functions, which it contracts, in the wall there can be cholesterol that accumulates, and that's stimulated by hypertension, by bad diets, etc., and sedentary lifestyle.
So
And
cholesterol,
the cholesterol is the
means
tradition means fat.
fat inside the vessel,
Inside the
vein.
vessels that
Right.
accumulates, and then step by step the true lumen through which the blood comes is becoming narrower and narrower. And what can eventually happen, that it occludes completely, or that these vessel walls rupture, and then the platelets come and they occlude the vessel. So then you got what we call heart attack.
Heart attack.
And this is the traditional way with cholesterol, the diet information. But with smoking, slightly different. There is some evidence that there are abnormalities in the platelet aggregation. That means the clotting of the blood. And all of a sudden,
Clotting of the
there
blood.
is not much atherosclerosis, the traditional obstruction, but all the platelets become hyperreactive and they clot. And in that way, you can also occlude a vessel, and that is mostly related with the smoking. There's also vasoreactivity, we call it, that the vessel walls are hyperreactive and therefore more vulnerable to obstructions. But that is the issue with smoking.
Right.
Yeah.
So, well, unfortunately, we have a short amount of time for our interview, and I would like to put my last question for you. Can you please advise and tell to our audience how to prevent heart disease and sustain healthy heart?
A lot of number of the risks we can reduce, like cessation of the smoking cessation. reducing alcohol intake,
Alcoholic.
more gym, more exercises, more dynamic life, and less stressful lifestyle, or management of stress by themselves, and the less fatty food to eat, more healthy diets, vegetables, etc. So in this regard, what we need to do in Mongolia as of today is we have to educate our population in this regard. Yes, we call it primary prevention. It means educate people, give them message, especially when they are young in the school children's age.
Right.
And also what we can do in one of the serious heart disease is rheumatic heart disease, which is caused by streptococcal infection, which is very common.
I don't know these words.
Yeah.
You have to
Yes, it's
explain these words.
Actually, this disease doesn't almost exist in Europe, in your country, but we still do have it.
Have it in Mongolia.
A high number of them. So, but it's so easy to prevent from the streptococcal disease to complicate with the heart valve disease.
Right.
And finally, it leads to the big, expensive, traumatic heart surgeries. So, what we are doing from the cardiac center of Mongolia, that we would like to, we actually implemented the activities, set of activities among the school children.
The children.
We worked out for the guideline methodology for teachers, for caregivers, for parents, and for them, for children as well, how to prevent from streptococcal infection and worsening or complications. So that activities we would like to expand, and if it's possible, we would like to implement these activities in every school of Mongolia.
Yeah. So, well, thank you very much. That's all for today. Thank you for being with us. We will see you on next Tuesday with more news and updates. Have a good one. Bye-bye.